Hong Kong researchers say they have developed the world's first nasal spray that provides pre-hospital emergency treatment for stroke patients. Called Nano-powder, it delivers neurotherapeutic medicine through the nose directly to the brain. It's designed to reduce brain damage from strokes by more than 80%. And improve survival rates. Professor Aviva Chow from the University of Hong Kong is here to tell us more. Thanks for joining us, Professor Chow. First, tell us, how does this work?
So our nasal spray contains the neuroprotective drugs with anti-inflammatory, antioxidant, and anti-apothetic properties. So when stroke onset or happening, so the patient themselves, the caregiver or the ambulance staff, they can directly insert our nasal spray within the patient nose, and simply by one push, the drop coming out and to try to protect the ischemic brain immediately.
What does this do? What is happening here?
So you can imagine this way, because our product integrate the nanotechnology, nose-to-brain delivery, and particle engineering. So we try to make a so-called nanoparticle together. But nanoparticle actually is too small for nose-to-brain delivery. So that's why we're using or develop a technology called Nano-micron. So we make the nanoparticle become a micron size and suitable for a nose-to-brain delivery, and the drug will be maximized within the ischemic brain and try to protect, our neuron.
To keep it alive.
Yes.
In other words, I see. So what is the current first-line treatment for ischemic stroke?
Currently, there are two major treatment strategies for ischemic stroke. So one is for intravenous injection and infusion of drug called TPA to the patient. So it helps to dissolve the blood clot. So another type is doing a surgery. So the clinician can remove the blood clots by doing the surgery. So I would say our breakthrough of our invention is we can do it pre-hospital, because both current treatment strategy, they could only be done in hospital.
So this is something that can be done at the scene before they get to hospital.
Exactly. So our nasal spray, you can see, is quite portable and easy to use. So in the future, the patient, the caregiver, or the ambulance staff, they can administer the drug immediately once the stroke onset.
So again, I guess to summarize, how does this become a game changer then in terms of stroke treatment?
So I think the major breakthrough or the game changer is about the pre-hospital setting. So as I mentioned, so both treatment could be done in hospital. So now we provide an additional option to the patient. So I would like to emphasize our nasal spray is not to replace the current treatment strategy, but rather than provide an additional or adjunct therapy to ischemic stroke, so that we can have a better protection to the ischemic brain for the patient.
So again, this treatment actually helps preserve the vessel, the nerves, the vessels, so they don't die. Is that correct? The neuron, sorry. So tell us, what is the figure for stroke cases in Hong Kong? How many patients do you think this kind of treatment would be able to help?
Yeah, so there are around 25,000 patients in Hong Kong for stroke every year. So, and the figure keep increasing because of the population aging. And I would like to also emphasize that in Chinese mainland, so the stroke actually is the top leading disease causing death and disability. So that's why this triggered us to invent this nasal spray. Talking about who would be suitable to use our nasal spray, I think, as I mentioned, our drug is neuroprotective. It's not a drug to dissolve or remove the blood clot. So in theory, it should be applicable to all of the stroke patients, not only the ischemic stroke, but also maybe hemorrhagic stroke, although we need to do more research and collect more data to support the claim.
Okay, and where are we now with the clinical trials?
So this is many people asking me this question. So basically now we complete all of the preclinical study, most of them, and including the formulation design and optimization, some cellular study, and also majority of the animal study. So we expect our product can start the clinical trial in 2030. But in between, we still have something we need to overcome. I think the major one would be we need to find an industrial partner for doing we call GMP manufacturing, good manufacturing practice. So because we need to make sure our product meets some quality compliance. So this will be one of the major milestone. But after the clinical trial, and once we get the approval, we would like to have our product to be used in first of all maybe in emergency setting, emergency department in the hospital or ambulance staff, and later on maybe go to the nursing home, and so that we can collect more feedback about our products. And eventually, and our target is to make sure to make this product available in community level, and everyone could buy one.
Is that how you foresee that perhaps this is something we can pick up at the pharmacy to have on standby in case of an emergency?
Yeah, this is our goal.
Okay, that sounds very exciting. Thank you very much, Professor Chow. And you can learn more about this Hong Kong innovation by visiting scmp.com.